I am Dr. Nimeka, a clinical sonologist and the course coordinator for Gracia Medicare Ultrasound Institute. So today we're going to talk about the history, the science, and how waves are propagated and made to become images on ultrasound. We will promise to make this very simple, practical, and very clear, so that at the end of this foundation lecture, you will appreciate how ultrasound. So what is our core focus in this first lecture? That is the level 1 course. Our core focus is number 1, core physics, the physics of ultrasound. That is the basis of ultrasound. Without you knowing the physics, you know nothing ultrasound. We need to know the machine knobology, that is the knobs. As you can see, these are the language of the sonologist, sonographer, and everybody that is dealing with ultrasound. We need to know the safety principles that guides the machine itself, the sonologist, and even the patient, which is very, very important. Then it covers introduction into abdominopelvic ultrasound. Yeah, so we're going to start with a brief history of how ultrasound started. It started by the sonar technology during the World War II. There was this war that was happening on the marine, and the opponents were defeated. Somebody actually did something, went under the sea submarine and used sound waves to locate the enemy's position and was sending missiles under the water through the echoes of these sound waves he was using to target the enemy. This science at 1950 was modified by a group of researchers who sat down and said, how can we apply this into ultrasound medicine? And this was the birth of the evolution of ultrasound medicine, such that today we now have high resolution scans. We now use sound waves to produce images that are safe, non-invasive, and are very indispensable at very, very cheap and affordable price. Now, what is ultrasound? Ultrasound is just a smart technology. It's just how we use sound waves to make images. And what is the basis of ultrasound? This is when sound waves above the range of hearing becomes images. At the frequency of 220 kilohertz, you cannot hear any sounds again. At that frequency, images can be formed. In ultrasound medicine, these images are made with about 2 to 15 megahertz and travel through organs and reflects echoes, which now produces images for the ultrasound. How does ultrasound work? It's very simple. Your transducer or your probe, which is something like this, you put it on the body or the organ you want to examine. It sends sound waves into this body through the piezoelectric crystals, and these waves produces back echoes that returns to the machine, and the machine interprets these echoes into tiny dots and produces a beautiful image following reflection that it gets. This is how we detect the heart rate of a baby. This is how we detect blood flow through organs or vessels in Doppler, and also through soft tissues. When these waves move, they hit an object. What happens is that they can either reflect, and you say this is echogenic, it can penetrate the object and can say it's anechoic, or depends on the density. For instance, for soft tissue, it reflects that these sound waves can actually hit the soft tissue and bounce back, that is reflection, and produce image. For instance, fluid, this sound waves can go in and pass through the fluid, and when it passes through the fluid, it produces a black image, which we call anechoic. For bone and air, it reflects the sound waves strongly. That is why we see a bright white color, and we say that this is what hyperechoic. So this depends on the depth, the speed, the frequency of the sound. So it covers introduction into abdominopelvic ultrasound. At this level, once you can complete this course at this level, you will have your level 1 basic certificate to do routine ultrasound scans. Thank you. Please, in summary, what have we said? We have talked about the history of ultrasound, why it is called an ultrasound and not just a sound, because it's a sound that you cannot hear with your ear. A sound at the highest frequency, 2 to 15 megahertz, and it is widely used in every field of medicine. So in our next lecture, we're going to be talking about machine safety and knobology, a practical side. If you enjoy this content, like, subscribe, and share. And don't forget to join our Telegram group for updates and discussions, because this is where you learn a lot. Don't forget to click the link on my bio to join the Telegram group. Till we meet again, my name is Dr. Chukuma. Thank you.